Okay, so this presentation is on health concerns of children with an intellectual disability or potentially a low IQ. Sorry, I'm gonna go forward here. There we go. All right, so a little background and description about children with intellectual disabilities. It is the most common developmental disability in the U.S. They usually have difficulties in intellectual functioning and adaptive behavior. Intellectual functioning includes tasks such as communication, learning, problem solving, and then the adaptive behavior would be everyday social skills, routines, hygiene, things like that. Can be mild or severe. More severe forms of intellectual disability require a lot more support, especially in school. Milder forms of it will allow the child to be a lot more independent, especially with good school programs and education. And they, generally will grow up and can be fairly independent as adults, kind of depending on the intellectual disability. So when identifying an intellectual disability, different signs include trouble speaking or a child learning to talk a little bit later than normal development, trouble understanding rules, trouble solving problems, trouble seeing consequences of actions, and then thinking logically can be an issue as well. The vulnerability for these health disparities include this population potentially living with complex health conditions. They may have limited access to health promotion programs and screenings. Their poor vision may go undetected if they have that. Any additional chronic conditions can be poorly managed. And then especially as they are older, for mental health problems, psychotropic medications can be used, and that can also add another level of the health disparities. And then a little history. Intellectual disabilities were formerly called mental retardation, but that term was changed in 2010 with the making of Rosa's Law, and where they now call it intellectual disabilities. And then about 6.5 million people today have an intellectual disability. Children 6 to 21 years old make up for about 545,000 of that total. So statewide, in Utah, about 5.3% of the population ages 6 to 21 is diagnosed with an intellectual disability. Nationally is a little bit higher, 7.6% of the population, and that could potentially be because as far as poverty and intellectual disability are related, Utah actually ranks about 41st on the list of the 51 states, with the poverty rate of 10.85%. So they're actually pretty low on the list when it comes to poverty rankings, or high, I should say, rather. So that could potentially explain why the statewide population of intellectual disability is a little lower, just because poverty and intellectual disability are related. The lower the poverty level, the higher the rate of intellectual disability. It's just kind of an additional note, it's much more common in low-income countries. Approximately 16.41 in every 1,000 people in low-income countries. So then internationally, like we said, globally, 200 million, about 1 to 3% of that population. All right, so contributing factors, social determinants of health that may contribute to intellectual disabilities. Access to educational economic and job opportunities. You have quality of education and job training, social norms and attitudes, and literacy. So these selected social determinants of health are potential contributing barriers to this population. For children who have intellectual disabilities, the quality of their education is important, and whether or not the school has a high quality special education program, that's one factor in determining their success and their ability to function normally with the public as they grow and develop. So this also goes for access to good special education programs. If a family lives in more of a low poverty area, there's usually not going to be that access to a really good special education program, and that's critical in helping that child develop and function a little more normally. So unfortunately, children with disabilities, intellectual disabilities, can have a lifelong difficulty of battling social norms, injustice, and bullying. And this social determinant of health can inhibit them from obtaining quality paying jobs, and then that would hence lead to better health care. Literacy as well as another determinant of health that may inhibit their good health if they don't know, how to get information or how to read about good information about good health. This could inhibit them. Okay, and next, all right, specific concerns, other contributing factors. So children with intellectual disabilities can have cognitive challenges in understanding, recognizing, and communicating their health concerns. They may lack the social and emotional skills to handle peer pressure, and then long-term medical care may be essential if they have any other secondary conditions because of the disability, and that can put financial strain on the family. Different health problems associated with a severe learning disability include seizures, mood disorders, motor skills impairment, vision problems, hearing problems. And then studies have shown that children, when they're bullied, when they have a learning disability, they are more likely to respond in aggression to all children, not just the bullying child. So that can create an issue as well. They're also twice as likely to be suspended as students without disabilities. And of course, then this is going to decrease class time, and also it will increase the dropout rate of this population. One of the root causes can potentially be higher rate is that the children with intellectual disabilities have higher rates of adverse health conditions. So this leads to disparities in attention to their care needs, which then leads to disparities in preventive care and health promotion practices, which leads to disparities in equitable access to health care, which ultimately leads to a poor health outcome when compared to a child with no intellectual disability. All right, when it comes to Maslow's hierarchy of needs, the bottom of the pyramid includes the physiological needs. So, and this is always going to vary based on the child and their family and how they grow up and whatnot. But for the strong majority, usually the physiological needs are being taken care of: breathing, food, water, shelter, that type of thing. Generally, safety is, their family, resources, their body. Again, health, that's a little iffy, just kind of depends from circumstance to circumstance. But usually the bottom two levels of the pyramid are being met. Generally above that is where it gets to be a little iffy. Belonging. Children with intellectual disabilities often have trouble with friendship and belonging. And then anything above that obviously can't be reached if, once there's kind of a crack in the pyramid. So esteem, self-esteem, confidence, achievement, respect of others, respect by others, sometimes those aren't met, and then self-actualization, problem solving, and creativity, and a lot of that has, generally is not met. So the anticipated functional level would be the safety, potentially the love and belonging. So the health outcomes likely would be that it's poorer than the normal population of kids without an intellectual disability. Yeah, if they cannot meet these lower needs, they're not going to be able to meet the higher needs. Okay, next, specific concerns when it comes to communicable diseases or infections. So children with intellectual disabilities are over 2 times as likely to be sexually abused, and then this could potentially lead to communicable sexually transmitted diseases. Violence prevention is a huge factor in stopping sexual abuse, which does lead to these communicable diseases or infections, and addressing those issues at an individual and community level is critical. And then creating protective environments and teaching skills, these children's skills to prevent sexual violence is only a start. And then we also need to educate parents on immunizations and why they're so important in preventing communicable diseases, because the lack of access to immunizations could also contribute. For non-communicable diseases, those with a intellectual disability are less likely to report poor health. They're more likely to live an inactive lifestyle, higher rates of victimization. That was kind of what I kind of goes along with the last slide, but there's more attention required from caregivers overall than the general population. They're less likely to receive appropriate treatment, because unfortunately providers can sometimes be reluctant in treating those with an intellectual disability. So yeah, they're oftentimes just really unable to verbalize these health issues as much, and that makes it harder to get them treated. So this, just requires a lot more attention on the parents' part and the teacher's part in kind of seeing these things, so that if the kids are not able to voice them themselves. So early prevention and screenings can help to prevent some of these secondary diseases or infections. So kids with intellectual disabilities are less likely to practice good hygiene. It may take them longer to learn good hygiene for their self-care. They may self-injure a little more likely. About 17% of children with intellectual disabilities self-injure themselves. And sometimes they'll even do it for reward. They think that when they do this to themselves, they get more special attention and a little more doting. Some even may do it to relieve discomfort because of these secondary health issues that they come across and that they're having a hard time voicing. So to prevent this, of course, parents should try to get help figuring out the root cause if they can't figure it out themselves. And other concerns, risk for harm by or to others. They're more likely, I kind of touched on this, they're more likely to be a little more aggressive towards others when bullied, not just to the bully. And they're also more likely to engage in negative behavior when they're feeling unsafe or lacking belonging. They have a harder time with social skills and dealing with peer pressure, so they may act out if they're bullied. And they're likely to be aggressive towards anyone, not just the bully. So they have trouble meeting the 3rd level of Maslow's hierarchy of needs, loving and belonging, and this kind of contributes to this specific concern. All right, and these are our references. Got several here. So yes, it is very important for children in this population to be, for parents and educators, just require a little extra special attention when it comes to preventing these.